Hi, everyone. Good morning, good afternoon, good evening, wherever you are. Thank you so much for joining in to the first TUGS Women Symposium. And we are extremely excited for this maiden endeavor. And we have a very good panel with us today and some great speakers who will inspire you a lot. Just a little word about TUGS Women. So this is, I think, one of the newest branches of TUGS that we have recently been able to start. And as the name suggests, it's going to be about women. Of course, we need the men's support as well. And we have so many of you here supporting us to this cause. So thank you all for joining in, and a very big thank you to our speakers and panelists who are going to be with us today. And I hope that this will be very inspiring for all of us, and we have a good show tonight. So I'm going to introduce our first speaker. Sorry for the interruption, but I think I should introduce the TUGS Women coordinators as well. I have with me Dr. Tejal Latya, who is the TUGS Women co-coordinator, and Dr. Elena Ruiz, who is an assistant coordinator, Dr. Noura Al-Faitouri, who's also an assistant co-coordinator, and Dr. Sakshi Sa, she is also an assistant coordinator for TUGS. So this is the team. And we have a committee as well, which consists of 30 members. Dr. Raziel is also one of the members of the committee. And so that's about it, about the committee and TUGS Women. We will now proceed with the first talk, which will be by Dr. Aznat Raziel. It is an absolute pleasure to introduce her. She is the medical director of Asia Bariatric and Israeli Multidisciplinary Center of Bariatric Surgery, and also of the Asia Medical Group and Asuta Medical Center. So Dr. Aznat, welcome, and please, we are waiting eagerly to hear you today. Thank you so much for joining us. Dr. Aznat, you need to unmute yourself.
I'm very pleased to join you presenting my career in surgery for women, making it work. For many years, I was in a kind of a race for self-realization. From the age of 17, I have dreamt of becoming a doctor and a surgeon with lots of passion to achieve things very fast. The journey to study and fulfill my goals was very intense, with a huge investment in learning and training and a lot of diligence and competition. After graduating med school, I've joined the army and served as a flying surgeon for 4 years. I was the chief doctor of the School of Pilots in Israel. I've taught the young pilots aviation medicine as well. I've joined the young cadets in their training and did lots of courses with them. This is me, hanging from the helicopter. Parachuting was a real challenge for me, as it required the best shape and to be really fit. I couldn't resist an offer from a friend in the base to teach me flying. In 1 year, I became a pilot myself. For a long time, I was flying at 6 a.m. and 6 p.m. every day. For 4 years of service in the Israeli Air Force, they were very, very intense. This is me as well, hanging from the helicopter in real mission. I had participated in a lot of missions in Gaza Strip during the first Intifada, which was a rebellion of Arab citizens in Gaza. I have rescued Israeli citizens in the desert and in different catastrophes, force, droning, and accidents. I was surrounded with highly motivated soldiers and had a huge adrenaline rush daily. I was flying, diving, parachuting, treating trauma patients in war zones, and I felt like I was a superhero. After 4 years in the army, I finally started my residency in general surgery in Tel Aviv. I did a long training periods with, which also included vascular, pediatric, thoracic surgery. I wanted to experience them all. During my residency, I've met Ronit, who became my wife. She still is, for 26 years. Together, we flew to Minneapolis, Minnesota, for a fellowship in minimally invasive surgery and bariatric surgery. I remember what a different feeling it was to see lots of nature around and to feel calm. I've operated a lot with Dr. Henry Backward, who is here with us today, who became a good friend of mine, and also with Dr. Saidi Kramdin. When I returned to Israel after 2 years, I've joined the group of leading surgeons called Asia Medical. I've established a multidisciplinary bariatric center, Asia Bariatrics, in Asuta Medical Center, Tel Aviv, Israel. The center is composed of 4 fellowship-trained bariatric surgeons, 4 general surgeons, 2 plastic surgeons, an endocrinologist, a gastroenterologist, 2 psychologists, 2 bariatric dietitians, clinical and administrative coordinators, and a dedicated nurse. Asia Bariatric became a role model for other bariatric centers in Israel. The patient is always in the center and surrounded by a multidisciplinary team that provides medical, nutritional, and psychological support. We have operated 6,300 bariatric procedures. The last decade was mostly mini gastric bypass, before it was mostly lap sleeve gastrectomies. 2018 was for me a year of transition and integration of body and mind. I've started to gain weight due to menopause and was very frustrated. I felt anger, loss of control, and that moved me to look for new tools to transform low emotions and develop spirituality. I've learned different approaches, including mindfulness, theta healing, awareness, and resilient techniques, holistic coaching. I've become calm, managed to control eating, added lots of physical training, and have built resilience. I've become softer. I've learned to live by here and now, be more attentive to my patients without fear or just being there for them instead of doing. I've managed to see that my change in attitude caused a change in frequency, which lets other type of patients reach me. Patients who cherish emotional attention and believe in body and mind connection. Patients willing to do a conscious work to change their life habits, achieve the goal of weight loss, and maintain the new weight for many years to follow. In Western medicine, when discussing weight loss, liberals appear. On those scales, we always see the terms diet and exercise. For years, no one have challenged this axiom, and we accepted it as it was Torah from Sinai, or God's wisdom. Reality, however, forced us to think outside the box. Everyone has already read or heard about the wonders of the Mediterranean diet and knows many kinds of other diets like Atkins, DASH, ketogenic nutrition, paleo diet, low carb diet, gluten-free and sugar-free diet, and many more. We all also fully understand that the equation of weight loss, there is an important place for physical activity. There are clear rules that guide walking for half an hour to an hour a day, do strength activity training 2 to 3 times per week. What is new now is that all over the world, people are now talking about the fact that these 2 variables are not enough. Stress reduction, mindfulness, self-conscious practice, must be added to change restrictive beliefs, remove mindset barriers, and pave the way to change habits and preserve them over time. Most of the patients who come to consult with me live with obesity for many years. Most of them know every possible diet, have tried countless ways to lose weight, know many dietitians, sometimes from a very young age in childhood. They were also engaged in sports during periods when they vigorously struggled for weight loss. But throughout life, no one has dared to ask them simple questions for clarification, such as, what are your gains from living with obesity? When I've asked my patients and directed them, many different answers were received. Being fat gives me power and strength. I ate and gained weight after sexual abuse in childhood, and now no one will dare hurting me again. I wore an armor to protect me because I didn't dare to appear in my own authentic me. I was afraid that they would not accept me or that they would not love me. This way, people do not see my faults, my shadow sides. They are busy only with my fat and leave me alone. I was exempt from school trips. No one has dared to fight with me. I've developed self-humor. I've become the life of the party. This way I got help from friends. Along with all these profits, there are also lots of difficulties that my patients share with me. I'm discriminated at work. People think I'm lazy. I do not have comfortable seat on a flight. I'm always looked at in a restaurant. People stare at my plate. I'm constantly being insulted. I do not date. I'm ashamed of sex. People think that I don't have a willpower. They think I'm not smart. They think I don't hear them talk about me. I've learned that there are ways to remove restrictive beliefs, identify childish protective mechanisms that can be waived, transform low emotions, balance chakras, live in the present. Ground yourself in different forms and not just by food. Learn mental flexibility, develop resilience, plug energetic holes, and keep high energetic level. Build flexible boundaries, change your frequency and attitude, live in passion and creation, realize your personal vision. I've just finished 3 years of spiritual studies by now and found a restrictive belief that I had for a long time, and I'd like to share it with you. It was a hidden well, while being constantly in front of my eyes, in the common phrases I use, in my lifestyle, in my frequency. You can guess, I have no time, I'm in a hurry, a race to the top. That's the sentences I used to tell myself. This was my life so far, packed with events, self-fulfillment, in a rapid fire pace, fast and sharp, riding in overdrive. Whereas now, when I imagine my life in 10 years, I choose another belief, a new one. I have all the time in the world. I'm watching a movie of myself in 10 years at a different pace, relaxed, smiling, achieving everything easily, surrounded by a lot of friends and lots of green nature around. I inspire clean air and positive atmosphere. I have lots of love in my life and self-satisfaction. Thank you very much for a great opportunity to share my life experience with you. I wish you happy and fulfilling life. I hope to meet you all in person along my journey. True love, Aznat.
Thank you so much, Dr. Raziel. I think it was an amazing journey, very, very inspiring and very beautiful. And with a lot of turns in your life, I think you've kind of shown us the path as to what we should be also looking at in future. I just had one question for you. This is a platform which is meant to inspire more women in coming into surgery and taking up surgery as a specialization. In this journey of yours, did you ever face any difficulties or any advantages because of your gender specifically.
Yes, and what I really wanted to emphasize is that all the time I thought it's like a tree that you should have a really heavy, uh, the base of the tree. And then I started to grow leaves and flexible branches. And this what helped me more than being, strong. You should be flexible. You should change your way of behavior according to what things are demanded from you.
All right, thank you so much. Thank you. Tejal, should we move on to the panel discussion, or is there any other question that we should take?
No, I think we move on to the panel discussion and then maybe take questions at the end.
Great. All right. Sounds good. I'll just share my screen.
And if anybody has any questions in the meanwhile, please feel free to put them in the chat box and we'll take them at the end of the panel discussion.
So it's my great honor to introduce Dr. Tejal Latya. Like I said right in the beginning, she is one of my best friends. We've known each other for more than half our lives. We also happen to be classmates. And she is a very renowned endocrinologist at Apollo and Fortis hospitals in Navi Mumbai. She's from India, and she has a special interest in diabetes reversal and digital therapeutics. I think these are just a few of her interests out of the many that she has. And she is also, I'm really honored to have her as TUGS Women co-coordinator with me. So over to you, Dr. Latya, so that you can probably introduce the panelists now. Thank you so much for being a part of this.
Aparna, will you just switch the slides for me? So Dr. Nimeri, has he joined or he's going to take a little bit longer?
I'm not sure if he's joined us yet,
so
but you can introduce him and then he can join.
Okay, so Dr. Abdul Rahman Ali Nimeri is the Associate Professor and the Chief of Pediatric Surgery and Metabolic Surgery and a Director at the Atrium Health Wealth Management, and is also the past President of IFSO. We also have Dr. Kelvin Woon. He is a consultant upper GI and pediatric surgeon from Penang at Penang General Hospital, Malaysia, also visiting consultant surgeon. Kelvin, please excuse me if I do not pronounce the name of that hospital, but the specialist center at Penang, Malaysia. And of course, it's a TUGS Asia coordinator. So thank you very much for accepting our invitation. This is it, right, the panel, Dr. Aparna?
And Shakshi.
Yeah, of course. So you will have to excuse me. I think Sakshi has not completed her medical training yet, but please forgive me if I keep referring to you as Dr. Shah, because everybody else here is a doctor. And Shakshi is a fourth-year MBBS student. She's an aspiring surgeon, and that is why we were very interested to have her on board today and kind of close the loop of women and surgeons from across the world who've been there, done that, and then a young aspiring medical student and how we can bridge the gap. So she's currently pursuing her MBBS at Parallel Institute of Medical Sciences and Research at Vadodara, India, and is also an assistant coordinator with us at TUGS Women. So before we go right on to the panel discussion, I just needed to make one comment on what Dr. Raziel presented. And I appreciated the fact that she brought out what we want to communicate to young medical students is that when we were training, the emphasis was on aspiring to be something, do something, and get there really fast, and just keep ticking the goals as you go along. And nobody told us that it was okay to kind of also enjoy yourself on the way, do it in a calm, paced manner, and also enjoy your life at the same time as that you're training to be an endocrinologist or a surgeon, especially those of us who do this, subspecialization. We're very motivated and, that kind of personality that we have. And somewhere along the way, I think we forget that we also need to balance our lives. So thank you very much for bringing out that aspect. My friend Reenu Sharma is a counselor. She's a psychologist. And about 3 years ago, we went for a cup of coffee. And, she said, you look very tired. And she kind of actually dissected out for me what my life was looking like. I'm just running around trying to get everything done, see so many patients. And she kind of made me stop and, reminded me that we are not God or godlike, and we deserve to just live like any other human being. So I think that is one very important message we want to give medical students who are joining in today, that even you may achieve everything in the world, but you also need to take time for yourself and live in a healthy manner. So Dr. Kelvin, I am going to ask you the first question. And so when you were training as a surgical resident, can you highlight for us some of the practical challenges that you faced in your training? And I'm sure you had colleagues and junior trainees with you who were also women. And do you think that the challenges were different for a woman surgical resident versus male surgical resident? What do you think?
Okay. Thank you, Dr. Tejal, for the kind introduction and the questions. So just a bit of myself. I'm an upper GI and bariatric surgeon, and I think the main problem that we face during our residency program, regardless which discipline that we are in, number one, we have to think about the work nature. I think surgical training is no doubt one of the toughest training, I would say, in among all disciplines. So when we choose this, you got to get ready to go through this, right? And I think the other thing about the training would be the training process itself. So generally, I'm not sure. I mean, each country has different time frame. For example, in Malaysia, it takes us about 8 to 10 years to be a specialist, and probably about 15 years to be a consultant surgeon. So that is really a long time that we need to be devoted to and commit ourselves during this training duration. So the time itself is something that will take, I mean, by the time we be a specialist, we'll be in the early 30s, if not mid 30s, and we'll be a consultant in the late 30s or early 40s. So these are the 10 to 15 years is the time that we have to think what actually we want to achieve in our life. If you want to be pursue in this career, you got to be committed, and probably you need to think along the way, beside my career, is there anything else that I want to plan along the way, especially about family planning, because this is a time where we find our partner and probably we settle down and have our children, right? So the other thing about the challenge probably is about frequent traveling. So during our training, we may have to shift from one center to the other. We won't be staying in one hospital all the time. So you may have to shift along the way. For example, for myself, I've shifted to about maybe 5 different centers. I was away from my family for at least 2 years. Then I went abroad again without them. So these are the things that you have to think during your training, and these are the challenges you may face. The other thing probably is about our personal and our family. So number one, psychosocial factor is one. You got to have a very strong mentality, because along the way, it's not only about working. You got to prepare for exams to make sure you pass them, and finally you get the necessary qualification to be a surgeon. And also you may face certain interpersonal relationship problem. For example, you may have difficult superiors or difficult colleagues, or even difficult patients. These are the things that you got to be tough and got to overcome them one by one. And of course, finally, it's about our family. And by and large, I would say for women in surgical training, no offense, but things are getting better, I would say, but there is certainly still a glass ceiling there. I mean, even in the literature we search through, there's still a glass ceiling for women, especially in surgical training, because these are mainly due to 3 factors, I guess. Number one is the traditional gender role that we have been brought out, especially in the East, right? So the other thing is about sexism. Of course, sexism is still always there. I mean, either it's a subtle or obvious, and including sexual harassment, either physically or verbally from the superior, from the colleague, or even from the patients. These are something that women may face more in comparison to the man. And lastly, it's about probably there is still a lack of mentor in the same gender. So that's why we need more women to join the surgical field and probably to guide the younger generations. And lastly, the attrition rate for surgical training, again, is the highest among all residency program. It's actually up to about 20%. So if you're going to join this, probably everybody, you got to get ready for these challenges and overcome them one by one and to achieve your goal. Right. That's my comment. Yeah.
I think I really want to credit you and thank you for addressing the elephant in the room, that yes, there is a glass ceiling. Yes, there is still sexism. There's still sexual harassment. And, something that you brought up, even from patients, a woman surgeon may face sexual harassment. So yeah, I think, and the point you made about having a lady mentor also would be really inspiring for them, because they will have the same challenges that you're likely to have. And also that if you want to be a surgical resident, you have to be absolutely sure that this is what you want to do, because it's a time investment of almost 15 years, right? And of course, and I just love the fact that all the surgeons are bringing about the importance of personal life, because when you're in medical school, you're always pushed to achieve. But I'm so happy that all of the surgeons so far who've spoken have all underlined the importance of balancing out your personal and your professional lives. And I really didn't think men had to think too much about the family planning aspect. So thank you for bringing that up also. I thought only women worried about that and not the men, but yeah, I'm sure you guys have the same issues. So thank you so much, Kelvin, and we will come back to you shortly. I see that Dr. Nimeri has joined the program. I can't see him though, but I can see his name. So Dr. Nimeri, are you here?
Yes, he's here, Tejal.
Yes, I'm here. Thank you for the invitation.
Yeah, so nice of you to join us today. I know you're busy and you have a lot of commitments today. So I'll just jump right to the question. And, I think a lot of, what can I say? The more and more women are entering the surgical field, definitely. But I still think, as Dr. Kelvin was saying, that there is a lesser number of women who are in the field. And you have worked, I think, in the Middle East, you worked in the US, so you have been exposed to a lot of maybe women surgeons, either as colleagues or as mentors or as trainees, and whatever. So what do you think is the difference in these two experiences, practicing in the Middle East, maybe practicing in the US, and what has been your experience with other women surgeons?
Sure. Thank you. So, I mean, I think the issue happens in diversity in general. So, when you look at the experience in the Middle East or in the US, culture plays a very significant role. So many places have their own culture, and if you look at practice of surgery today in the US, it's very different than practice of surgery when we were residents. I think there are things that we used to happen when we were residents that are not acceptable today. And I think the issue is not only with women not having the ability to break the glass ceiling, as you would say, but also ethnic minorities, many other things. I mean, in the past, I mean, I'll give you a good example about the US. So if you are an international medical graduate, it's very difficult to break into the US system, whether you're a man or woman, and you have to prove yourself twice as much. If you are an ethnic minority, you're underrepresented, and it's more difficult. And I think what was mentioned earlier about finding a mentor is important. For instance, right now in our department in the US, for the first time, we have a vice chair of diversity, equity, and inclusion. I mean, we used to have vice chairs of quality, education, research, but it was never, important to have a vice chair of diversity, equity, and inclusion. And when you look at things, I mean, the laundry list of things that we need to do is very, very high. If you look at, for instance, what women go through, women patients in Africa because of obstetric injuries and how difficult it is to treat it, I think culture has a very significant role. So if you look at surgical training, in the past at least, a woman would find it very difficult to go through the process because she will not find a mentor who's a professor or an assistant professor in front of her who's like her. And I think things have improved a little bit, but there's a long way to go. And the issue is not only, I mean, I think the diversity is important when it comes to women, but we need to make sure diversity, equity, and inclusion includes everything else, because there are many other things that are also that needs work.
So if you had maybe some advice to give aspiring medical students, women who wanted to become surgeons, so how do they go about it? Anything that you would like to tell them?
Sure. I think the most important thing is for everybody to ask themselves, what would make me happy? If you look at, how many of us select specialties is because we saw someone in that specialty that we admired, we liked what they did, and we want to, be like them in many ways. I think the most important thing, what you mentioned earlier about the importance of family, what are your priorities in life? And this doesn't only pertains to women, this pertains to men and women, is you have to recognize what is more important for you, because what makes me happy might not make you happy, might not make Kevin happy. And I think the second thing is we now live in a world and a place where it is okay to speak up. So if for instance you notice that people are not giving you opportunities, you need to speak up about it, and you need to say that, what, I mean, why is it that when it comes to selection, I'm not selected? I think it's okay to speak up. And in general, no field should be secluded for any specific gender or race or where you finished your training. And at the end of the day, everybody should seek what they like and enjoy. And if it is something that you want to do, it doesn't matter how long it takes, it doesn't matter how difficult it is.
Right. So if you enjoy what you do, then the journey is pretty, it's a pleasant journey. But the point that you brought up, I'd really like to, emphasize on it, is Dr. Aparna and I have had this conversation many times, and she has had a lot of female trainees. And what she understood the difference between women and male trainees is that male trainees they speak up and they ask that, I want to assist in this surgery, or I would like to participate in this. And women tend to speak up less. So I think that piece of advice that you're giving, that it's okay to speak up and to ask for what is your due and not be maybe ashamed or embarrassed about it. I think that's a very important piece of advice that women medical students need to take home.
And I would even add, in some cultures, when you speak up and you're a woman, it looked at negatively. And
yes,
at the end of the day, you shouldn't care. I mean, I'll give you like an example. We had a female fellow a couple of years ago, and she mentioned to me that she notices that in front of the patients, when the attendings introduce her, they will introduce her by her first name, but when they introduce her male colleagues, they introduce them by Dr. So. And I love the fact that she spoke up and she said that. And I think that's what's important. What's important is, if there's something that bothers you, you shouldn't be quiet about it. And you could actually make the point in a very gentle way. And the most important thing is to have intuition about when to say what you need to say to make it the most effective. And to stay involved. It's actually a great opportunity right now for women and underrepresented minorities in many places, because this is now an issue that we're looking at. So if you want to be involved, it's actually not as difficult as it was 20 years ago. It's not where it needs to be, but at least it's a little bit better.
That's so very true. And picking the right moment, and maybe not speaking up, maybe in front of all the colleagues, but maybe waiting to see the person, in their chamber and then address the question. Yes, that I agree with you. But yeah, speaking up, if something bothers you, speak up. And I really appreciate what you're saying, because traditionally, so let me give you an example. That we had a meeting and there was a mix of men and women. And one of the women had a lot of ideas. And at the end of the meeting, when everybody logged out, and she's very aggressive. So this is what women fear, that when they speak up, they're labeled as aggressive or I'm sure all the women surgeons have this experience. So that is why they hesitate to speak up. But yeah, I think that we still must speak up, irrespective of what somebody would label you.
And I tell you, I think this is also part of the job of other colleagues.
Correct.
You know, when someone says something like this, and you know, other men or women colleagues keep quiet, this is what perpetuates this happening.
Yes.
But if people said no, I mean, her or she was just making her opinion, then you know, it becomes uncomfortable for someone to make those comments and try to label someone a certain way. But this is actually not unusual, you know, trying to label someone with a negative connotation because they're outspoken or they voice their opinion.
So not only the woman needs to speak up, but yeah, support from colleagues, he for she, that movement, I think, yeah, that's the way to go ahead. Thank you so much for your comments, and we'll come back to you. My next question actually just naturally evolves is Shakshi is here. So I'm going to call you Dr. Shakshi because I know you're going to clear the exam and you are going to become a surgeon. So Shakshi, when you thought about becoming a surgeon, I'm sure you looked around you, and especially where you are training, and we've had previous conversations about this, there aren't many women surgeons around. So what do you think is the biggest barrier you foresee for yourself to become a surgeon?
Hello all, first of all. I was passionate to take surgery from my school days. So when I got into MBBS, I actually said my parents and my family members, I want to be a surgeon. So first question, they were like, if you will be a surgeon, how will you be helpful to us? I was like, in what way? They are like, surgeon's job is to just cut and stitch. Okay, surgeons don't give medicines. So you are no helpful to us. I said, is it like I'm going to be MBBS doctor? So I know the basic things. I can give medicine. So many were like, family physician are the best because they can give medicines, they can treat you. Surgeon can't do anything. So that made me sad. I was sad at first, but then I decided like it's my passion and that is the thing which is making me happy. So I'm going to take that only as my field of choice. I'm not going to listen anyone. And then next question they did me that what about your marriage life? At what age will marry? What about your kids? What about like traveling? When you are pregnant, you are not going to travel. Like these questions they did to me, and they were like that female surgeons are so less. Female surgeons are not being valued much and all. So many questions they did to me, and they were really like that you have given this many years and you will study still 15-20 years, then when you will marry, then how you will live your family life and all. These questions they did to me, and they were like so sad from me. They were like, they would like counsel me every day. Like, Shakshi, this is family physician. It's a great field. You should go to a physician. You should get yourself counseled. That physician job is the best. You will get your family life and everything. I was like, no, but I want to take surgery as my passion. I literally said them. But then I was like, my dad was, and you know, it's like I belong from a non-medical family, so we don't have any experience. We don't have any doctors in house, so it's but obvious that they don't know much of doctors and all. So I guess the most important problem is gender bias faced by a female from a non-medical family, because medical family will understand that to take up any branch you love is a good thing, because when you do what you love, you can excel in that. Like there is no force and pressure to you.
So what I understand is the most important barrier is from your own family first. So that's the first barrier you have to overcome.
Yeah, but I did overcome that. Thanks to my professors in my college, they are really supportive to me. Like my professor, who is a TUGS member also, he's a bariatric surgeon, Dr. Chirag Parikh. His support is like much. He supports me every time. He also he said to my dad also that her passion is being in surgery, because I assist sir in surgeries. I also do surgery with him. Like he always tells me that, Shakshi, go and get yourself scrub. You are gonna do this thing. So he tells me that you have to speak up for yourself. He always tells me these things. And then my dad eventually understood that it's like she likes surgery only and she want to take that only. And now like my family members, they support me. Like they all got understood, and they are like, when anyone asked me that after MBBS, what are you going to pursue? Like my MBBS will end in 3-4 months. The ma'am doctor, officially I will be a doctor. So my Dadi says then that she wants to be a surgeon and she will be the amazing surgeon. So now they are eventually supporting me. And like really, I'm really feeling blessed that I am getting family support. But many of women, they don't get family support. Like I can give my example. When I said to my neighbor that I want to be a surgeon, then she was like, you are a female now. Why won't you opt surgery? Go and opt gynecology. Gynecology is a branch of females only. You will get female patient only. You don't have to operate on male people. Like seriously, she told me
So the
this.
point being that a man can operate on both, but a woman can't operate on the male gender. Is
Yeah,
that
she was like, yeah, she was like that. She explained me that why gynecology is good for girls. I'm like, I want to be surgeon. I personally, I don't like gynecology. I literally told her. In fact, my gynecology department also knows that I hate gynecology.
so
So
no offense
really,
to any family physicians and gynecologists here, but yeah, Shakshi
yeah,
doesn't like.
no offense. No offense to any
And
branch. I always
what about your colleagues? What about your classmates? What did they think about it?
like what my classmates comment, like I have a short height. I'm not I have a medium short height, so my classmates always tell me that you are a short height person, how would you operate, you won't reach to a table also. Like they may make such comments. First these things used to make me sad, but then my dad's friend is a neurosurgeon, so he gave me example that his professor was short in height and they all were long. So he said me that he used the stool and he used to stand on stool and he used to operate. So okay, you can also do that thing now. Why you are bothered by someone else's opinion and comments? It's your life now. You can do anything. You can do table down. You can stand up on stool and operate. Height doesn't matter. Then my dad gave me the example of Sachin Tendulkar, like Indian cricketer. He said that he has a short height. Still he played. Why can't you operate? My dad is very much supportive to me, and that's really helpful to me. And so my colleagues still comment that your height is small, you won't be a good surgeon, you are not gonna be in this field and all. But I don't mind now because I'm like, I want to be a surgeon and I will do the best. Height doesn't matter, gender also doesn't matter. It's my passion, I'm happy doing that. Then why should I not pursue it? Then other comments I receive is whenever I talk to some male surgeons, they are like, I really say them, I want to be a surgeon. They are like, okay, take surgery. Then they are like to me, when you do super specialty, go for plastic surgery and pediatric surgery. I asked why. They say that plastic surgery and pediatric surgery is good for women. Like women can give family time. Being a, I also said like I want to be a trauma surgeon. Then what? Say trauma requires emergency and you want a family time. I said I will try to balance my life. I also want a family, so I will balance it. But they make these comments and all. And some surgeons are not happy when I go in OT also. They are like, why female wants to come in OT and see operations? And I have heard all these things, but I have not reacted. Really, this all things makes me sad sometimes. But I am like,
It's
my family
almost
is
like
like,
people. It's almost like people want any excuse that you do not become a surgeon. It almost sounds like that.
yeah,
You're too short, you're a
yeah.
woman, then family life. So there's like a whole list of excuses that can be offered to dissuade you from becoming a surgeon.
Yes, actually.
But you
But
are committed, as Dr. Kelvin said, that once you commit, and then it has to be for the long haul.
yes, my professors and my school friends are very supportive. They always support me. They are like, they all are non-medical. They are like, do what your heart says. They always tell me that only. And I'm doing that only. Like my heart says, I want to be a surgeon. I will be a surgeon. Okay, height and all doesn't matter. And I have decided to be a surgeon and I would become a surgeon soon.
You will, and we're happy that as soon as you become we want you then to be a member of TUGS as officially a surgeon, and we look forward to that. So, Dr.
Yeah,
Raziel, can
sure.
I ask you the next question? Which is pertaining to what Shakshi was just talking about. So, always, whenever a woman's surgical career is brought up, and I'm so glad that Kelvin talked about the family planning issues that even men have. But whenever a woman's surgical career is spoken of, it is always irrevocably bound to the time that she can devote to family and to having kids. And what are your thoughts on that? Do you find it annoying? Do you think it's a question that needs to be asked?
I am not the right person to answer this question because I don't have kids myself and I'm married to a girl. So it's completely different. But I think that during your residency, you have to give up lots of other things that you like. And
Correct.
It doesn't matter if you give up family or kids or choose other way of life. I gave up a big love of my life was flying. The first year of residency, Chachi, I woke up very early and I continued to fly at 5 a.m., 6 a.m. before the morning rounds. And I used to take all the world with me, nurses, sanitars, people from the operating room, just to experience that. But then it became really tough. I couldn't plan ahead a flight and have 2 or 3 nights without sleeping in the emergency room and do all together. So I gave it up. But like Shakshi said, I knew I'm going to be a doctor and I knew I'm going to be a surgeon. And I think that my family also knew it. By the age of 6, I got a present from my parents. It was a microscope. And I used to look at hair and other things through the microscope and liked it very much. And of course, they didn't know for sure that I'm going to be a doctor, but they imagined it, I guess. And later on, when I was in my medical school, in the summer vacations, I used to pick places all around the world and to go and train over there. I used to write letters and send them by mail. It took sometimes a month to arrive. But then I arranged myself a fellowship in cardiac surgery in Lausanne, Switzerland, and by the age of 19 or something like this. And then another one in UCLA in trauma. And I really worked with the teams there. And it was really a great experience. And then I managed to fix another fellowship during my med school. It was medical students exchange program, something like this. And then the third one was in France, and I speak French. So it was really, really a great opportunity to live in Paris and to walk there and to take a car and to ride to the hospital. And then after, I, like Kelvin said, every time that I had a conference or something, it was a really great experience to look at other people, how they operate, to see their experience. It was a break for me from hard working. It was like a vacation. I like the conferences so much. Every time, 1 year, I think that I flew every month to another conference. I was so excited and thrilled by the vacations that I arranged to fly every month. Now the Corona, it's my first time after 2 years that I'm abroad now. I'm in vacation in Greece and I'm speaking and I'm seeing the sunset through the window.
So the point that I got from what you were saying is there are sacrifices. There is a trade-off, be it a man, be it a woman, if not only family planning, but yes, maybe you have to sacrifice some other passions that you have, some other hobbies that you have. So there is always a trade-off somewhere or the other, especially in the life of a surgeon, because I think in the medical specialty, probably the trade-off is not as great as what a surgeon has. And also just you're simply awe-inspiring as the number of different surgical trainings that you have done. And I hope that all the medical students who are listening know that it's possible. So that's the reason we're having this panel discussion is to see people like you from across the world and, understand that it is possible, to do that. So I have a few comments that I would like to share. And Dr. Kelvin is saying that family planning, especially childbirth, is important. So Kelvin, would you just like to unmute yourself and make that comment, please?
Sure. As I said before, during the residency training year is when we are between 20 to 40s. This is the time where we should have our children. If not, we will go beyond 40s, probably the chance of you getting fertile or the risk of getting maybe a congenital problem with the babies are higher. So we can consider having baby earlier in our career, maybe even before we join the residency program, and other things that I think certainly will help for childbearing family, those that are pursuing surgery, is you must have very supportive family, especially your spouse, right? I guess all of you have very supportive husband or partners, yeah, because you are in this a field that actually require a lot of commitment, right? And also maybe your family members can help you take care of your children. And from the institutional level, probably they should give more leeway for parenting staff. For example, maybe longer maternity leave, more benefits for mothers, and also maybe less night calls for those that have young children. Or maybe we can make the training program a bit longer to suit this group of workers. Maybe they can do like at a part-time basis. Instead of making a residency program of 5 years, they can actually go on for 6 to 7 years. Yep, this is something that may help for them to have a balance between the family and their career.
Yeah. So very important points, having a supportive spouse. Now, the problem in India is we have the concept of arranged marriages. So it's almost like a lucky dip and you don't really know what your spouse is going to turn out to be. So of course, most of us doctors, we manage to find our own partners, and all of us, maybe not all of us anymore have arranged marriages, but that's one of the tricky things in India, is you don't know what your spouse would be and how he would be. So yeah, I think that's the luck of the draw. But very important points, having an important having a supportive spouse. Even Alessandro is making the same comment that, these gender roles, the rigid gender roles that we have defined, is that this is woman's work and this is man's work. Those boundaries need to be blurred if we go ahead. And some of the other suggestions you made about, more maternity time, as more and more women surgeons come to the top, they are in positions of power, and only then that equation can change. That is what I think. So having made that point about arranged marriages and supportive spouses, I would like to go back to Dr. Nimeri and ask him this question, that you have worked in the Middle East, and in one of our talks with Dr. Noura, we had also spoken about how in some traditional cultures, men are not comfortable going to women surgeons and things like. So could you maybe cast some light on maybe an aspiring surgeon from a country where the culture is different and more restrictive for women, how the situation is?
Sure. So I think, every coin has two sides, and it might be true that men might not be comfortable seeing a woman surgeon, but the reverse is also true. Women are more comfortable seeing a woman surgeon. So when I was in Abu Dhabi, we had two female surgeons, and when they joined us, I looked at how busy their clinics, and their clinics were busier than the male surgeons. And the reason was because many reasons. One of them, in addition to skill and everything, is that women were more comfortable seeing them. So not everything is a total disadvantage. Sometimes there are items that are advantageous. So at the end of the day, as I said earlier about cultural things, if you look at what gender issues there are in the Middle East versus Europe versus Asia versus the US, I think they're very different, and the stages of progress are very, very different. And I go back to say culture is a very important factor in all this.
Yeah, but unfortunately, culture is also something which is very slow to change. It changes at a glacial pace. So yeah, but I really am so happy you brought up that point, that it could sometimes also be an advantage being a woman surgeon, is because more women will be more comfortable with you. And it almost seems as if, you know, I think it's the duty of more women to become surgeons and train as surgeons, so women can better access medical care as well. Because from what I understand, from what I've seen and heard, often it is also an obstacle for a woman seeking care if she doesn't find a woman surgeon, and you know, she hesitates to approach a male surgeon. There can be a delay in seeking medical help and getting appropriate attention. Have you had any experience like that, where, you know, somebody is delayed accessing medical care? And
I mean, I don't have specific examples, but like I've had times where you know, patients would say that they're more comfortable seeing someone of their same gender rather than seeing a male. I mean, I like when I was in Abu Dhabi, that was very, very common.
so as an endocrinologist, I also face that problem, because we always have to look at sexual maturity rating of young, you know, pubertal children, and often men who come to us with hypogonadism. And we also face similar challenges where sometimes the man may not be very comfortable in dressing in front of us as he would be to a male colleague. So I think this is something which yeah, you have to take it as it comes. Thank you so much. And Dr. Kelvin, I just wanted to ask a kind of a cheeky question, that you are the TUGS Asia coordinator and we are the women coordinators. Do you really think there is a need for women's wings? And is it only in our mind that we think that things are not inclusive? Or do you really need to have a separate women's wing of any organization?
Very good question. And I think having a woman's wing certainly is important and is necessary, especially for example, in surgical practice. Since I mentioned earlier, number one, there is a short of a mentor of the same gender. We need more female surgeons to inspire the younger generation, and also for the trainees to have someone to fall upon, to consult, to get support. So having a female wing certainly, I mean a woman's wing certainly will help in the training. And also the other thing, as Dr. Naimari has mentioned, certain patients, for example, female patients, they prefer female surgeons, right? Having a woman's wing, again, we can actually direct this group of patients to seek help and come to the female surgeon or the female doctors. So I think these are two very important points that we should keep the women's wing alive and actually flying. We should recruit more female surgeons or female doctors, and it certainly helps in not only the training but also in providing the care for the patients. Yeah.
What about research? Do you think, Dr. Kelvin, that women bring another aspect to research, and maybe we look more at, outcomes which probably may be more relevant from a woman's perspective?
For the research part, I think, again, I mean, I've gone through some literature. Again, it has shown that women doctors tend to get lesser funding for research, right? So actually having a woman's wing will help you to fight for more rights and fight for more funding and more support, and even for promotion, and even the salary is, there's a gap between male and female doctors across the world. So having a woman's wing certainly is like to fight for the rights for the woman. Yeah, and doing more research on this part, probably with the evidence-based medicine nowadays, is something more supportive for us to promote this wing. Yeah.
So thank you, Dr. Kelvin, for acknowledging that there is a problem and it needs to be looked at. And, what you spoke, that's just one point I want to emphasize. This again, Dr. Aparna and I have had numerous conversations about this, is about professional remuneration, salaries. And here I will emphasize what Dr. Nimeri said, that women need to speak up. Often we do not ask what is the financial remuneration. We don't bother to find out, or even if we deserve more, women tend to be more hesitant about speaking up and asking for their rights. So yeah, maybe having a women's wing, looking at women like Dr. Raziel, Dr. Bhaskar, Dr. Elena, and all of them, I think it will give more courage to other women as well to speak up. But I hope for a day when we won't need to have a women's wing for any organization. And as Dr. Nimeri said repeatedly, we have an inclusive of all things, gender, race, culture, and everything like that. Perfect. So I wanted to go back to Shakshi, and I just wanted to ask her that, Shakshi, you have been listening to us for about 40 minutes now. And if I had to ask you like 2 or 3 main things that you think you've learned that would help you on your path as a medical student aspiring to be a surgeon, what would they be?
First of all, to speak up for yourself. That's the main part I learned, and it's really necessary to speak up for our own self, because the way our colleagues harass us, and many male surgeons I have seen, like they do harassment in OT also and after OT also. Like they will make some weird comment and all. So I think so that this thing is very necessary. Like if we will speak up now, so more women can get power, and then they can also take their gene field. I have seen many women not taking surgery due to this issue only, that males are making the weird comments, and we don't get chance to speak for our own self. So that I learned. And from Dr. Ashnat, as she said that health is also important. So I learned that health is important. Our own peaceful mind is also important, because when these things are like proper, now we can also talk with our patients properly. So our own mindfulness is necessary, like to meditate is necessary, to relieve our anxiety and stress and everything is also necessary to be a good doctor first of all, then to be a good surgeon. And
Correct.
rest, I, as Dr. Kevin said, that family life is also important. So I always believe to make a balanced life, like being a surgeon plus having a family, we can balance and we can work, and a supportive spouse is necessary. I don't know, like everyone gets, but yeah, if you get a supportive husband, then it's really good. And also supportive family, like the
Yeah, I was thinking
like
about
the
the
way,
husband part, so we have to find a husband for you who's
yeah,
supportive.
sure. And
Okay.
most important is family support. The way I'm getting my family support, I explain them a lot, and now they're supporting me. I guess that's necessary, because family support will keep you motivated also. Like when I'm sad now, my dad keeps me motivating that don't get sad, you are gonna do this and all. So I think this all things I learned.
And I also think it's inspirational that how your family initially was not sold on the idea. They had no prior experience. So it's not like your family doesn't care. They did care a lot, but
Yes,
because they had
yes.
no prior experience, they were hesitant of exposing you to maybe a world which they were unfamiliar with. And as time went on, they looked at your passion, they looked at your commitment, and that helped them understand that this is something that she truly desires, and how they transform the way that they deal with you. And I think that's really appreciable. And having all
Yes.
these people here on board in the TUGS group, I think this is also for young aspiring medical students. You can reach out to them and help your parents or whoever it is see that how a better life is possible. So I think, Aparna, how much time do we have? Last 5 to 10 minutes?
Yes.
So just a very quick question, Dr. Nimeri, if you had a choice, would you still become a surgeon again?
I would. But I tell you something. I tell many young trainees that I meet is that in life, you think you want something, and what becomes of you is not necessarily what you planned. So I planned to be an engineer when I was in high school, and I entered an internal medicine residency program initially, and then switched to surgery. And I did not like bariatric surgery in fellowship. Matter of fact, I took a job that had no bariatric surgery requirements. But then I was exposed to very experienced bariatric surgeons in that job. So at the end of the day, it's not important what you're planning to do. It's important to do your best at what comes your way. And
Wow.
I'll say this to everybody, because you could have great plans about what you want to do, but then the opportunities that present itself are different. So you need to be practical, pragmatic, and take the opportunities that come your way. If I would go back, I would still choose bariatric surgery, but I did not choose it. It somehow chose me.
Oh, that's wonderful what you said. So then, making the best of the opportunities that you have and not fretting about what was not possible and just believing in the plan that life has for you. Amazing. Dr. Kelvin, would you still be a surgeon again?
Yeah, certainly. I still want to be a surgeon, right? I think I really concur what Dr. Nimari has said. Be at the right time, at the right place, with the right person, right? I was inspired by one of my professors in surgery, Professor Kandasamy, when I was a third year medical student. Since then, I wanted to be a surgeon, and how I pursue my career without any delay. So it's along the way who we met, and what situation we were in and made us who we are. So like Dr. Raziel has said also, enjoy the journey, slowly enjoy the journey. Don't rush to the finish point and just want to get the results. You enjoy the journey. Along the way, you actually will discover more and you will feel more contented and always have a work-life balance.
Wonderful, wonderful. Dr. Raziel, would you be a pilot or a surgeon?
I didn't mention that once in one of my sessions with my parents, I addressed them a question. I wanted to be an astronaut as well. It was Friday evening. It was a meal, a very nice one. And me and a friend of mine, we both wanted to be astronauts, and we found out already with NASA everything to apply for that. And they said, "Come on, you're crazy. You are thinking of stupid things, etc., etc." But then he applied, and I had to do my army service, and then I studied residency. And I said, "Okay, I give it up." And he became a doctor of NASA, the one that checks your blood pressure when you are up there near the moon, etc. And I became a surgeon because I chose it, and I still am learning and developing, and I know my next steps all the time. Now I know that I want to develop in robotic bariatric surgery and bring it over to be really common in Israel, because it's not that common in Israel yet. And as before, I learned how to do things and brought them to Israel and then taught others and became a pioneer. I would like very much to go now to India and learn it from you guys there.
Yeah. Very nice points that you brought up. One is what also Dr. Nimeri and Dr. Kelvin said, it's you may not always be 100% certain what you want to do. You still may have other options, but then as the opportunities present themselves, you take them forward. But what I liked, especially about what you said, is we also have always our next step, at least a little bit of plan about it. Then what are we going to do next, and not rest on our laurels and I've done everything and I've achieved everything. There's always a process that you keep on learning and growing. I think that's amazing. Dr. Elena had a question for Dr. Raziel. Dr. Elena, would you like to unmute yourself and just address your question directly? I hope she's still here.
Elena, you need to unmute yourself. She's here.
Yeah, she's here. She's
okay.
So Dr. Yeah, please address your question to Dr. Raziel.
Yes, yeah. It's just about regarding to if she had the spirit, she has the experience to having working in two different countries, very different countries, Israel and States. So could you please talk us about if you found some difference about the treatment because your gender in Israel and in US, because they are very different cultures, of course. So
I managed to work also in in Europe, in many different places for short periods of time, like in Belgium, in France, and in Germany, and also in India. I operated in Pune, we say, Pune. And I think every place is different. But if you find somebody that you relate to and can act as a mentor for you, then things are really, really calm and easier. And if you don't have friends and you are afraid to expose your feelings and to speak with other people, then it's a little bit harder. So I think that you should always keep a smile on your face, even if it's hard. Because I remember when I was very young, I went to UCLA, and it was very, very hard to me to get involved there, because people were really tense. And I came from Israel, where everything is very, very free. And it was a different culture. So I couldn't really enjoy things as I enjoyed it later in life when I joined Professor Buchwald in Minnesota. Over there, I came with my spirit, and I wanted to do things fast. And first I remember that I carried the patient to the operating room, and he said, "Come on, you should relax. There are people that are doing it for 100 years already. They are preparing things for you. You should go to the other room, read a book or something, relax, and let other people do the work, because otherwise, like 100 people will be fired tomorrow because you're doing things for them." And I imagine that there is a lot of different atmosphere in different places, and you should learn from your friends how to behave, how to fit yourself to the culture.
So I think what you, this one point, I think probably is a take-home message for the panel is, having a mentor, and everybody, kind of reflected the same thing. Dr. Kelvin said he had a mentor who he looked up to, and that's why he decided to become a surgeon. Dr. Nimeri spoke about having a mentor, having people around you speak up for you, especially for a woman surgeon. You speak of how a mentor from a similar culture who has the same experience can help you, kind of handhold you to negotiate that culture and understand, we do need to adapt our behavior to the culture that, we practice in. And and you worked all across the world, and everywhere you've had to kind of adapt yourself and fit yourself into whatever that culture is. Dr. Elena, does that answer your question? Is there anything else you would like to ask her?
No, yes, a question. Okay, thank you.
Thank you. So negotiating cultures is difficult, and finding a mentor who has been there, done that, you can speak up, you handhold, would probably be the way to go. So I think this has been an amazing panel, and I'm just going to give the baton back to Dr. Aparna to close the session if there aren't any more questions.
Thank you so much, Tejal. I think it was a wonderful, wonderful panel, and you conducted it even more beautifully. So thanks a lot. Thank you to all the panelists. And I think I just have one message to give to women who are aspiring to be surgeons. I know that we can't plan everything in life, but when we are taking a decision about specifically about what specialty we are choosing, I think we should follow our heart. And whatever our heart tells us, and if it is possible, we should go ahead and do it, and not retract just because probably it's not practical or because there's lack of support. Because when you make a choice, I think the path clears out by itself, and things just happen one by one. You can't plan your entire life, but I think that one step, you must not be scared of taking it forward. And that would be my closing remark. Of course, I think Tejas already summarized everything, but I think what women really need to learn is to ask for a seat at the table. So do not hesitate to ask for a seat at the table. Do not hesitate to ask questions. It's just a matter of time. I think with TUGS Women, that's the whole idea, that we start having these conversations, because these are conversations which we normally do not have in our usual conferences or in, I think, in surgery classrooms. So it is very important to have these conversations. And if it inspires even one woman to become a surgeon, I think we would have achieved our aim. And I think that one woman today is going to be Sakshi. So I'm sure that she was already motivated enough, but I'm sure we have reinforced her resolve, and we hope to see you as a surgeon one day, Sakshi. Thank you so much, everyone, for attending this. And Dr. Aznat, I think your journey was so amazingly beautiful. We are so inspired. I think I'm going to really sleep well tonight. Thank you so much. Thank you, everybody.
Thank you. Good night. Bye. Bye.
Thank you. Good night. Good night. Thank you.
Good night, everyone. Thank you so much.
Thanks a lot. Bye-bye.
Thanks, everyone. Appreciate it.
Bye.